Hi, my name is Cole Bloomfield, and for my HOD 2400 project, I am doing an industry research overview on the field of healthcare consulting. So what is healthcare consulting? As you can see from this definition provided by IBISWorld, healthcare consulting is really taking the more generalized consulting field of work and specializing it to the healthcare industry. Now, I want to give a specific market overview of what really drives the healthcare consulting industry. There's key economic drivers, such as for these healthcare providers, like hospitals, like insurance brokers, physicians, to gain greater profit. There's also the drivers of Medicare and Medicaid funding, as well as government consumption and investment. So then, there are these economic drivers, and then the industries that have a demand for healthcare consultants to help them navigate these trials and tribulations that they face are people like Big Pharma, the big pharmaceutical companies, healthcare and social assistance providers. These are more of the insurance types, as well as hospitals, who often need help in making sure that they're operating as efficiently as possible, providing the best services that they can. Now, building off of that, how does one become a healthcare consultant? What are the skills that are needed? There are your general consulting skills, which range everywhere from finance to HR to IT, marketing strategy, and really, again, important to be a team-oriented person and being really good at working collaboratively in teams. That's what IBISWorld identified, and IBISWorld is the site of all of the research that I'm presenting in this screencast. Now, I'm sorry, I divulged. Going back to it. So IBIS was talking about, in order to become a healthcare consultant, it's really important to be familiar or have experience with one of these four main areas of the healthcare industry, which are litigation and regulation surrounding healthcare, the government and the government's involvement and relationship with the healthcare market, as well as nuanced health technologies and health management. And by health management, I really mean managing hospitals. Now, technology has had a moderate effect on the healthcare consulting industry over about the last 5 to 10 years. The advent of technology hasn't really taken away any healthcare consulting jobs. It's still a very labor-intensive field. So again, no jobs have really been lost, and healthcare consulting jobs have been lost to automation per se. Technology has played a critical role in ensuring that all of that critical information, such as client information about people's and hospitals' medical records, as well as all proprietary firm knowledge, is secure. That's become really, really important, and it's become a place where using nuanced technologies has become really critical. And lastly, IT services have been the highest level of change that technology has affected on the healthcare consulting industry. And the reason why is very simple. Lots of hospitals have wanted to change over from paper systems to more internet-based systems, and they've turned to healthcare consultants to help them. In terms of an employment outlook, the healthcare consulting field looks excellent, looks in a very strong place in terms of employment. IBIS was identifying that there's lots of reform that is being done with healthcare, and that's going to lead to more regulation, which will then lead to more business for healthcare consultants. And as you can see, there's strong growth projected for this industry. This is all in terms of profit per employees, this revenue. And also, the healthcare and healthcare costs and healthcare policy is getting more media coverage, which again is only going to further the need for healthcare consultants. There are 5 major employers in the healthcare consulting field. They are Accenture, Huron Consulting Group, the advisory board company, and then 2 of the big 4 consulting groups, Pricewaterhouse and Cooper, and Deloitte. And then lastly, I hope to have some tools to continue learning about this field and better preparing myself to becoming a healthcare consultant, hopefully one day soon. Continuing to use IBISWorld, looking at the websites of the major employers I just listed, and also using the internet, using various media publications to become up to date about all the latest nuances in healthcare. Thank you so much, and I hope you enjoyed it.